10, the strain is building again. Pennsylvania hospitals are under growing pressure because of rising COVID cases.
New data compiled by the New York Times shows Pennsylvania is now first in the country in the average daily number of people hospitalized with COVID. And one of the state's big hospital systems says all our beds are full. More on that in a moment. That's the Geisinger Health System reporting at 110% capacity across its 9 hospitals. Hospitals are struggling not only with high capacity and overly busy ERs, but with staffing shortages. The New York Times data not only has Pennsylvania tops in the nation in COVID hospitalizations now, but second in the nation in average daily numbers of COVID deaths at 98 per day. All of this has one Lehigh Valley Health System making policy changes, as WFMZ's Joy Howe reports.
St. Luke's University Health Network has restricted its visitation policy to 2 people per patient, telling the Associated Press that, quote, the current surge, largely driven by the unvaccinated population, is placing an enormous burden on our region's healthcare system. That's according to Dr. Jeffrey Jari, St. Luke's Vice President of Medical and Academic Affairs. St. Luke's is reporting 220 COVID patients across its 14 campuses, which, if you compare to the hospital's numbers this time last year, looks eerily similar. Meantime, one of the state's largest healthcare systems says it's running into a major problem because of this surge. Geisinger Health System says it's running out of beds across its 9 hospitals in central and northeastern PA. Geisinger says it's running at 110% capacity, and the message is the same at St. Luke's. The problem, they say, is stemming from unvaccinated COVID-19 patients, which make up the overwhelming numbers inside hospital walls. Geisinger reported that because of being overrun with COVID patients, their doctors and nurses are practicing what they call waiting room medicine, where patients are dealing with 10 to 20-hour delays in ERs. Numbers are spiking all over Pennsylvania. Take a look at these charts. Last January, Pennsylvania's health department reported numbers spiked at more than 12,000 COVID-19 cases a day. Those numbers tapered off, and in fact, 6 months ago, cases dropped to less than 100 a day. But fast forward 6 months later, and the numbers are spiking again, hitting just under 7,000 cases a day. Officials at Geisinger told the Associated Press they don't expect the situation to get better in the coming weeks, rather the opposite. They expect case numbers to get worse. Joy Howe, 69 News.